We believe that health is really the underpinning to wellness and prosperity at any level, whether it's the family level, the community level, the national level. It's just foundational. And so that is the main reason why ReThink Health does the work that it does. And I think that another piece would be the costs. The costs are simply unsustainable. 17% of GDP, growing, healthcare costs growing by 6 or 7% a year. It's just unsustainable. So two major drivers for why ReThink Health is engaged in the work that it's engaged in. And I think a part of this question too was about why I am involved in this work. And I think that it relates very much to why ReThink Health as an organization does the work. But for me, it's on a more personal level, it's foundational to everything. I mean, if you don't have health, you have nothing. You can't build anything. And think about all of the times when you find out somebody in your family has questions around their health, or there's a diagnosis that's scary. I mean, everything just kind of stops. So I think that's why I personally am engaged in this work. And sometimes you can talk a lot about the science and the theory and the work that's happening in the communities, but it all just kind of comes down to the people. There have been, obviously, in the past several years, we've come to see that health is created in a myriad of ways. And so it's only logical that to redesign the system, you have to have cross-sector and intersector partnerships where all of the different pieces of the system and all of the different pieces of the puzzle come together and contribute to take it apart and redesign it and put it back together. So you can't just have it led by one person. You really have to have this kind of intersector cooperation and collaboration. ReThink Health supports cross-sector partnerships in a couple of different ways. One is really doing research and advancing insights. And the other is working with communities on the ground and providing support and guidance and coaching as they're engaged in this work to really help accelerate their progress. We are big believers in systems thinking, which is the $100 word for the day. But really, it's just about this ability to look at the broader health system and get it all of the pieces moving in the right direction. ReThink Health does something called the Pulse Check Survey every other year. And we survey the field around stewardship and strategy and financing. And we did some phone calls. And I still think about this conversation I had with this one woman in Kansas who was leading some population health efforts. And I hung up the phone and I said, that woman is a bulldog. I mean, she was so tenacious and I just loved it. I mean, the passion that people bring to this work is incredible. And I can't go too long without actually being able to go and talk with people who are on the ground doing the work, because I think it just grounds you in what's happening. I mean, we all say it's hard work. It's really hard work. I mean, even just saying that doesn't pay it the respect that it deserves.